Okay, so welcome to the MRCEM OSCE course, and thank you so much for joining. So today is going to be an orientation. I just want to have a discussion with all of you about what your reservations are about OSCE. What do you think is the hardest thing about OSCE? What weaknesses do you want me to help you work on? And what will the course actually entail? This is one of our regular courses, the long ones, and we are transitioning out of these regular courses. So it might be just once a year in the future, maybe, or we might just get rid of the regular course entirely, maybe in the future. But for now, I think that a regular course, a bit longer course, is necessary for helping out people who are going for OSCE, especially from Pakistan. So that's the plan. And how about I go through what the 6 week course is going to look like for all of you, and then we have a chat about what we expect from the course and what your reservations are. Okay. So a total of 18 sessions are going to be conducted over a period of 6 weeks. We will have 2 hour sessions, Monday, Wednesday, Saturday. My preference is going to be this late night hour. For anybody who has trouble with live class, can have access to the recording till the end of the course. So we will hand you those recordings. However, since this is a practical exam and we do encourage conversation, so my suggestion would be try and attend it live as much as you can. Okay. So Monday, Wednesday, Saturday, 2 hours is going to be divided into these chunks. So we're going to do 30 minutes of format where I will just tell you the approach, okay? And then 30 minutes of a station that I will run first. I will show you how to do that station. It's not going to be exactly 30 minutes. I'm just going to do the station in 8 minutes. And then it's just a little bit of feedback, any questions, anything else. And then the next 1 hour is going to solely focus on scenarios, and then you would, okay? Now, I know that during these days, so Monday, Wednesday, Saturday, not all of you will get to practice in the 60-minute practice chunk. Maximum 2 stations can be run. And so 2 participants will be selected each day. So each week, since we've got 6 of you, I can divide 2 each day. And if somebody gets the exam, if you have applied for the exam, if you get the exam confirmation, then it's going to be a bit different. The practicing can change, but that's why I've put this session earlier on. So during this time, all of you don't have a seat yet. You have applied for the exam, so you are serious. And I want all of you to try and participate. At least it doesn't matter how bad you do the station. It doesn't matter how well you do. All I want is for you to start talking. That's all we need during these sessions. Okay. So in the first week, so today's orientation, we will not do anything else except have a discussion about what your weaknesses are, what you have questions about, because from Monday, we will solely focus on our stations, our patterns, and be very specific about it. So any other questions, anything regarding OSCE, about travel, booking, finances, or station, how they've changed, anything you want to ask today, so that we have room for actual stations from Monday. Okay. So on Monday, we will start off with history. We'll go through the model station and we will try and do all types of stations. So ping stations, presentation stations, event history, all of those things. On Wednesday, we will try and assess, we'll go through like psych history, basics of psychiatric history, and then practice that. On Saturday, just because it will be a bit boring with the history and psych, just to add a bit of flavor, we will do bad news and conflict, or just one of them, not all of it, but just some of it. And in between these days, so Monday I take a lecture, Tuesday you guys are free. Divide into groups, find your partner among yourselves and practice, even if it's one station. And what I encouraged, even with my last batch, what we did was I would ask them to practice among themselves and record themselves if they can. Just an audio, you don't need a video recording. Record your audios and then send them to me privately about you doing the station so that I can give you feedback. And that option is open throughout the course. Okay, you practice, you send me that, and I can give you feedback. If you miss the live sessions, you can do that as well. And then week 2 is when we start getting into cardiovascular and shortness of breath kind of histories. If we haven't covered them before, we do examination along with history. We cover one examination or two examination system with one history station and then practice. Because obviously we will not be able to actively practice examinations. It's just you going through the theory and then learning to verbalize it. But during those times, so Tuesday, Thursday, Friday, these days, if you are employed and going to work, my advice would be that you start practicing those. So whatever examination we cover, you practice it the next day. All right. And that will help you further polish your skills and keep continuing them. Don't let go of these skills then. Then we've got week 3 when we are going to focus on some specialized specialties, basically. So peds, gynae, we will do their history, the specific stations that can come with peds, that can come with urology and gynae, like hematuria, vaginal sexual history, all of those. And obviously on Saturday, we're going to cover some of those important procedures that can come related to these specialties. Okay. Week 4, we are going to further go into procedures and start touching on recess with those procedures. So airway skills, C-spine, and then the whole of your recess. My advice for week 4 is going to be over the weekend, after week 3, go over your algorithms. Okay. You have to do the study part. And all of you have given your SBA. Anybody who's just given their SBA is in the best position to practice for OSCE because their knowledge is very fresh and they are going to do this really, really well. But if you have given the SBA and it's been a year and the knowledge has started to fade, please start reading up on your recess specifically. Open your recess UK guidelines, ACLS, ALS, APLS, all of those, and please start reading them up and learning them again. Week 5 is going to be basically joint examination. Any remaining procedures that are left that are important, eye ENT examination and OSCEs, any examination stations that we've left. And then Saturday is going to be basically just troubleshooting any other station that I feel like is left or we haven't covered. And then week 6 is basically our mock circuit. So I have devised 6 to 8 station mock circuits, and each of you will get to do them. So since you are 6, each of you will do a station and we will have a discussion about it. Okay, that's how it's going to work. Now, we can change these up. This is not hard and fast. It will depend on the day, how I feel, how your energy levels are, and we'll decide how we want to go over these topics and what we want to cover each and every single day. Okay, now, I want you to know that this course is supposed to equip you with all the information and you will not need another course. However, there are 2 things that I ask from you. One is that you try and be on time so that we start on time and we end on time. Second, that you practice. You practice with me live, you practice on your days off, and if you want feedback on it, you send me the recordings. If you don't want feedback, you think you can practice among yourselves, go ahead and practice among yourselves. But keep practicing, at least 1 station a day, nothing more. 8 minutes, 1 station a day for both partners is going to take you like 30 minutes, a total with like some discussion. So I'd say 30 minutes of practice every day. And if you get your December or January exam, you are sure to pass it. All right. Now let's hear it from all of you.